Hello. Good morning. Good morning. Good morning. How are you today? Yeah, ask Dr. Fab. Dr. Rabiu Fatima Amoke is my name. Happy to see you this morning. Yeah, I was thinking about what we should talk about today. I think we'll talk about blood pressure, if you're okay with that. Yeah, blood pressure, you've heard when people say, oh, they have hypertension, or doctor says, I have BP. Everybody has BP, quite all right. But when they say, doctor says, I have BP, it means doctor says, my blood pressure is high. I'll try not to exceed 5 minutes and you stop. Now, your blood pressure is actually the pressure at which your heart beats. It pumps in blood to all the organs in your body. Organs and organelles. Organs are bigger things, while the organelles are smaller things. And the pressure at which it contracts is that one when it pumps those blood. The blood vessels and everything, the pressure there being pumped to your organs. While when it relaxes is when the heart is relaxing. Now, the one that pumps blood, while it pumps blood to your body, is what we call the systolic blood pressure. While the one when the heart relaxes is what we call the diastolic. So when you see your doctor tell you, oh, your BP is, let's have a good BP now. Your BP is 120/80. That means your heart is pumping your blood at a pressure of 120. While your heart is relaxing, when it's relaxing after doing a lot of work, the heart does like this, pum, pum, pum. At times it does as if it's doing a pum, 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 pum. But nature, God has it in such a way that, in fact, when it has worked, it now reduces or relaxes. So the one at which the heart relaxes is the one we call diastolic. Okay? So if you have a BP that is 120/80, that means 120 is the pressure at which your heart is pumping things or pumping blood to your organs, to your body, your kidneys, your heart, your brain, your liver, your spleen, your ovaries, your testicles, your colon, your digestive system. While when it relaxes, that's the pressure below. So if they say 120/80, the pressure below is that 80, which is the pressure it relaxes. Now, when we say somebody has high blood pressure, it means that person's blood pressure, the upper one, the systolic one, is more than 140. Let's just have a round figure, because there are some various or some variegated numbers or ranges now. And the lower one, when it is more than 80. So any blood pressure that is greater or equal to 140/80 millimeters of mercury means that person has high blood pressure. Now, there are things that predispose people to high blood pressure. Okay, you could have what we call a familial tendency that some people will just call genetic. Oh, your mommy, your daddy, your first degree relatives, your mom, your dad, your siblings, they have high blood pressure. So you are having that risk of having high blood pressure as well. You are somebody that have chronic diseases such as the one affecting the kidneys, chronic kidney disease, you can have high blood pressure. If you are somebody that have endocrine disorders such as diabetes, long-standing diabetes, you can have high blood pressure. If you have some drugs that you have taken and it has caused a lot of harm to your body, to your organs, you can have high blood pressure. If you smoke, you can have high blood pressure. There are some diseases in the gynecological area that can actually have a link. Some metabolic disorders that can actually have a link with high blood pressure. Now, when you have been diagnosed, we have this problem of people saying that is over my dead body. I don't have high blood pressure. I cannot have. Doctor, don't give me drug. I don't have it. It's not in my family. It's not in this. It's not in that. You see, it is not a crime to actually have hypertension, but it is in